I'm Patrice Wolfe. I'm the CEO of AGS Health.
I'm Thomas Thatapudi. I'm Chief Information Officer for AGS Health.
AGS is a global revenue cycle product and services company that supports large US health systems. And we really think of ourselves as a strategic growth partner to our customers, where we bring both AI, technology solutions, and services to help solve their revenue cycle problems. Yeah, the US healthcare provider market is really in a crisis financially. Many health systems and large physician practices are really struggling with profitability. COVID really damaged the fundamental business for many health systems. And even though a lot of the services that they provide their patients have come back, they're facing a lot of cost challenges these days with inflation, with the Great Resignation and the high cost of staffing, particularly clinical staff, and also the loss of some of their investment income. So these financial challenges are really forcing them to look at new ways to solve problems. And those new ways come in a few shapes and sizes. One is trying to find areas where they can use automation and technology instead of people. And the other is ways of finding new sources of talented professionals who can do some of the work that they're having a hard time hiring for.
Absolutely. So we have the proprietary AI platform that helps customers do their coding services better, their AR services better, their financial front-end clearance services better. What we mean by that is we do recognize that the customers do need people. So we're not saying that automation will solve 100% of the problems and will completely eliminate the need for people. But what we use the AI platform is to intelligently judge what kind of work demands automation and what kind of work demands human resources. And so we are able to parse out and elegantly distribute the work so that the portion of work that goes towards bots and towards automation has one workflow, and the work that falls out and absolutely needs human intervention comes into a different workflow and is presented to our professionally trained, college-educated resources who are spread across the globe. And these resources take that work and do that work in an intelligent fashion and present it back. And so when the customer looks at it, it all cohesively comes together, both the automation and the human resources, and they have one comprehensive solution that they can depend on.
Sure. Yeah, let me talk a little bit about a very large multi-specialty physician practice that we work with. They have about 8,000 docs around the United States, so really big organization. And we started working with them maybe 8 years ago, more on staff augmentation and outsourcing side, where we've taken some of the more detailed revenue cycle work and we've brought it offshore for them. And then a couple of years ago, they decided they wanted to also bring automation and AI technology into how some of the work is done. And so then I'll let Thomas talk a little bit about that side of it.
And as you can imagine, this particular customer that we're talking about, they were looking at external partners who can help them in their automation journey. But what they kind of recognize is that these vendors are coming in without a lot of knowledge, without knowing the context, and they were trying to figure out these opportunities. And we got an opportunity to present to them, to tell them that we can actually help them in this automation journey. We're intimately aware of the processes, we are intimately aware of the metrics, we know what is actually working, not working. And so when we come up with an automation journey in partnership with them, it's a much more collaborative approach, and it helps us nail the right problems and also helps us prioritize what we actually work on. And what we bring to the table is not just automation resources who know UiPath or Automation Anywhere. Of course, they're trained on all the right technologies, but these resources are also complemented with the right subject matter experts and the customer service experts who recognize what the actual problem statement is. And so when we build an automation solution, whether it's denial management or whether it's looking at fetching claims statuses from third-party providers, we know exactly what the problem statement is. And so we have a much better solution to present to them, and a much more inexpensive and an actual practical solution that works for them.
And what they've seen since we've been doing this is improvement in the quality and the turnaround time in some of the revenue cycle activities. We've needed fewer people to do the work, and just the accuracy of some of the work has gone up. So we love working with this customer because basically their attitude is, okay, we solved that problem. What's next? What can you work with me on next? They're a great partner to us.